This is video 2 of week 1 for Introduction to Pediatric Nursing, and we were talking about ethical and legal issues, emancipation, and informed consent. Like I said, when you give informed consent, when a patient signs informed consent, they must know the risks versus the benefits. Yes, doctors are required to get the consent from the patient, but it is certainly the nurse's responsibility to make sure the consent is signed before a procedure takes place, and also to answer any questions the patient might have after the doctor leaves. Whenever there is genetic or innovative therapies, the consent becomes even more crucial and more difficult. And it is so important that the family be properly educated of all of what can go right and what can go wrong. There are many public programs and services available for children. WIC is a program, it's Women's, Infants, and Children, and it provides basic food and formula for either mothers with small children. If the mother's breastfeeding, there are food requirements that are provided for the mother. If she's formula feeding, they provide formula. They also provide cereal, I think bread, rice, milk, and cheese. Those are the main ones for small children and families. Head Start is a very, very cool program. It is a preschool program for children who are at risk for either developmental delays or educational issues. Medicaid and CHIP. CHIP is just the Pennsylvania brand of Medicaid, and this is an insurance policy that's available for people with children who can't afford to insure them independently. And then this one, which is extremely important, is the early and periodic screening and diagnostic treatment program. And what this program does, this is the program that's usually run through the pediatrician's office, health clinic. Sometimes the health department will have an early periodic screening and diagnostic treatment program. And basically that's making sure kids get their shots, making sure their teeth are checked, making sure they're having all their well checks and they're growing appropriately. These are all done through those programs with the hope that they can deter a major problem before it becomes a major expense, honestly. There are special needs programs, speech, occupational therapy, special education, and counseling services that are available for children under the Education for All Handicapped Children Act. Every child, no matter how disabled they are, is allowed and provided an education. When you go to pediatric specialty care, which is one of the primary sites we send you to for clinical, you are going to see children that you just don't believe that they have the ability to learn, and they will have teachers coming in to teach them. That is because it is a right in the United States to have an education, and the earlier the intervention, the better. Again, I talked about collaboration earlier, and here are just a few of the services that collaborate together to provide the best care for children, especially children who have special needs. They provide preventative care, primary care, specialty care, respite care, and long-term care. Respite care is quite often for the parents or the caregivers who just need a break. If they have a child who is permanently trached or ventilated, a child with severe behavioral issues, sometimes for the health and the safety of the child as well as the parents, they just need a break. And here are just a few of the collaborative efforts that are involved in providing those breaks. As you go through this podcast, you could also be pulling up your own copy of the PowerPoint and stopping at points where there are videos embedded. Throughout this course, you're going to be talking a lot about Healthy People 2020, and I'm sure you have in your med search courses also. And one of the biggest pushes for Healthy People 2020 is the incredible obesity rate that we have in the United States, and it is an ever-growing problem. Actually, they were talking about it at my church on Sunday, and they were talking about how obesity rates in children are getting close to the 30% mark. And if you have an obese child, you're going to have an obese adult. And you don't want to start high blood pressure issues, obesity issues, all of the healthcare morbidities that go along with obesity so young. So that is one of the goals for Healthy People 2020, is to reduce obesity rates. Why do you think preventative care is an important part of pediatric nursing? Well, most of you, especially those of you who are parents, are probably like, well, duh, we want to make sure that they're healthy, that they are, they have their immunizations. By the way, HAC is a pro-immunization facility. So when we educate, we're going to talk about immunizations and why we're for them. If you are not a pro-immunization person, that's totally fine. Just understand that HAC has to take a stand on some of these issues, and that's the stand that they take, as do most healthcare facilities in the region. If you personally don't believe in immunizations, or you have a patient who doesn't, that's okay. And there are ways to care for children properly. You can't tell a patient or their family you must immunize. You can just tell them the risks and the benefits of both. So we do preventative care for a lot of reasons. First of all, we want to keep the child healthy and happy. We want to keep the family stress-free. And honestly, a lot has to do with monies that are available. The healthier we keep kids, the less their health care costs are going to cost us, the government, whatever medical insurance company they're in. So I don't mean to be a cynic, because I'm certainly not. And I hope that the main reason is to keep that child healthy and to anticipate a problem. I think that's one of the most important things that you need to come away from your nursing education with. It's maybe not how to treat an appendectomy, not how to treat a broken leg, but to know how to catch that kid before they're coming out of the tree, how to see a bellyache and react to it before it ruptures. All of that anticipatory guidance that you can give to the parent is only going to save the child and keep them healthier longer. Next issue we're going to talk about is the issue of child abuse and neglect, which I'm sure is near and dear to every one of our hearts for a lot of different reasons. Our job in nursing is to identify child abuse, to look for the signs and symptoms of it, and to do what we can to keep that child safe and heal the family and make them whole again, so that they can function appropriately in society. There are tons of reasons that people are child abusers, and it crosses all kinds of socioeconomic, cultural boundaries. You do not have to be poor to be a child abuser. In fact, rich people tend to be more dangerous as child abusers because they have the legal power to cover it up. You don't have to have no faith or be fundamental or whatever faith restrictions you might have to be a child abuser. It unfortunately covers all ground. Any person can be at risk to be abused or to be an abuser. So our job is to determine what's going on with the child and then find a way to fix it. CAPTA is the Child Abuse Prevention and Treatment Act. Any behavior directed towards a child by a parent, guardian, caregiver, or other family member or adult that endangers or impairs the child's physical or emotional health and development. That is the definition of child abuse. There are 4 categories: emotional, physical, sexual, and neglectful abuse. Any act by a parent or a caregiver or a person in power over the child that can cause behavioral, cognitive, emotional, or mental disorders, Children have a hard time when they have behavioral or cognitive disorders. They have a hard time telling you they've been abused because they don't know what words to use, and it's very difficult to verify. Um, but any kind of neglect or emotional abuse, you might not see the signs and symptoms of it because, at least not at first, um, because they don't leave marks. But words can cut, and they, as this PowerPoint says, they wound the child's spirit. And if that child is continually being emotionally reduced, they're never going to be able to stand up and either fight for themselves or fully recover. It destroys their self-confidence, their self-esteem. I mean, just think about it in your life if anybody's told you there's something that you can't do. And maybe they didn't even mean it to be mean. Maybe they just said it. Maybe it was a sibling. It affects you and you carry it with you throughout your life. So emotional abuse, neglectful abuse is hard to identify until it becomes horrific, especially with neglect, like when you see a child start to starve. Very, very sad. And if you have any inkling that there's something going on, act on that inkling. You're a mandated reporter. Don't ever think that you can't report something because you don't know. You can report a suspicion. It's perfectly fine to do that. I think this picture says 1,000 words, and they're all very sad words. If you see a child cowering in front of their parents, not answering your question, lowering their eyes when you ask them a question because they're afraid to answer, you might consider some of this going on, either emotionally, if not physically. So when a child comes in with physical abuse, that's easier to see. You might see unexplained injuries, repeated injuries. Oh, I broke my arm. The next, month, oh, I broke my other arm. They might have marks on their body, and then they'll tell you the marks and the injuries don't make sense with the story. And that seems to be the biggest hallmark for identifying physical abuse. Parents might have different stories if you separate the parents and get the story, or they might have a story that is so exactly the same that you know it's rehearsed. So these are the kind of things that you have to look for when you're talking about child abuse. Another one is shaken baby syndrome. You're going to see some babies who live at pediatric specialty care who are victims of shaken baby syndrome. They were perfectly healthy infants when they were born and shaken and abused, causing brain damage, and now some of them are blind, permanently vented, all kinds of things. So as you're learning about child abuse, really focus your mind on how to prevent it. And one way you can prevent shaken baby syndrome is to make sure that the caregivers are getting rest. If there is a newborn who is not sleeping, eventually that is going to take its toll on the mom if she doesn't get some rest, or whoever that primary caregiver is. So again, as you're thinking, think about anticipatory guidance. And what you can do to get that mom some help before there's a problem. And then there is sexual abuse, and any kind of sexual behavior involving a child must be committed by a person responsible for the child to be considered child abuse. So two little children exploring is not sexual abuse. That's childhood exploration. If it's a stranger, it's sexual assault. There are physical, non-physical, and violent categories for sexual abuse. Physical involves fondling, intercourse. Non-physical is taking pictures of the child and putting them online. And then violent, I'm not even going to speak of it. It's just horrible. And this is all criminal. And one of the most dangerous things is they tell children, don't tell anyone or I'll hurt your mom. It's time to go on to the next video. I hate to change in such a dynamic conversation, but this is video 2. And